Hi everyone, my name is Kourtni Reed and I am very excited to talk with you today about a topic that I am very passionate about. I graduated from the Doctor of Occupational Therapy program at St. Ambrose University in 2019. While in the program, the topic of my research and doctoral work was that of therapeutic nighttime positioning as part of 24-hour postural care. The purpose of this presentation is to raise awareness on that of nighttime positioning and advocate for the use of this intervention. My name may look familiar to some of you as I am a member of the CDKL5 Facebook page, as my sweet nephew Carter was initially diagnosed with CDKL5 when he was 3 years old. With the birth of his brother, who was presenting just like him, additional tests were able to be ran and it was determined that their genetic mutation was TBCD. Disclaimer-wise, I am an occupational therapist and currently work for a complex rehab technology supplier. I am not promoting any equipment and this presentation is for educational purposes only. There will be a live Q&A where I will be available to answer any of your questions in regards to this presentation. So before we go over background information on this topic, I would like to show you visuals of nighttime positioning in action. As you can see in the before picture, the individual's body is in an asymmetrical position. In addition, this individual has severe and complex physical disabilities, inhibiting them from moving themselves independently and freely. Therefore, this individual could potentially spend extended periods of time in this destructive habitual posture. As you can see in the after picture, postural supports or nighttime positioning equipment is in place to help the individual assume a supported and more aligned position. By utilizing nighttime positioning equipment, we are striving to decrease and/or restore body shape deformities by supporting the body in an aligned position while lying. Can you imagine lying in the unaligned position, so the before picture, for hours at a time? Here's another visual of nighttime positioning as part of 24-hour postural care in action. You can see in the before picture that the individual is lying in an asymmetrical and unsupported position. You then see in the after picture that postural supports are in place to help the individual assume a more aligned position. Here is one more visual of nighttime positioning as part of 24-hour postural care in place. Again, in this before picture, we have an unaligned and unsupported posture, with the after picture depicting a more symmetrical and aligned position. We will now discuss some background information on this topic. 24-hour postural care is one of the most important health interventions for those with severe and complex physical disabilities. 24-hour postural care simply includes symmetrically positioning the body over the entire 24-hour period while sitting, standing, and lying. Within 24-hour postural care is therapeutic nighttime positioning, utilizing equipment that aims to decrease deformity while increasing comfort in the lying orientation, whether that be when resting and/or sleeping. It has been proposed that nighttime positioning is an effective approach to not only protect, but to restore the body shape of those with body shape distortions. The inability to move oneself independently and freely leads to the development of habitual postures. Over time, these habitual postures result in the development of body shape distortions. These body shape distortions have the potential to significantly impact the quality of life of those with multiple disabilities. There are 3 orientations attainable to human beings, and they include sitting, standing, and lying. While the orientations of sitting and standing are regularly addressed in North America, the lying orientation is often overlooked. And this is concerning as adults spend approximately 1/3 of their time in the lying orientation, and this proportion is even greater in childhood. This is my nephew Carter, who was the reason I became an OT and picked this topic for my research and doctoral work while in the program. With these pictures, I wanted to provide a comparison of daytime positioning versus that of nighttime positioning. As you can see, daytime positioning includes several pieces of equipment. We have special seating systems, wheelchairs, and and standards. A lot of emphasis, resources, and time are placed into promoting supported postures throughout the day. But you'll notice no systems or equipment in place for nighttime postural support, which, as you can see, can be very detrimental to body shape as one is unable to move themselves out of these positions. You can see turning of the head to one side, rotation of the chest, windswept legs, which are up and over to one side, the rotation of hips, knees, and ankles. This raises concerns and questions as individuals spend a lot of time in bed. There are 8,760 hours within a year. For those who have motor limitations or complex needs, at least 3,650 of those hours are spent in the lying position while resting or sleeping. Therefore, if nighttime positioning isn't addressed, those 3,650 hours spent in the lying position can quickly turn destructive due to the development of habitual postures, the effects of gravity over time, and the inability to move oneself. If the body is not supported while lying, all of the postural care interventions utilized throughout the daytime are less likely to be successful. In addition, human bodies are less influenced by tone throughout the nighttime period. Therefore, gravity can be utilized in a beneficial way. By not addressing the whole 24-hour period, other interventions, for example, medications and orthopedic surgeries, are less likely to result in improved outcomes. Let's address nighttime positioning to work to make these 3,650 therapeutic instead of destructive. Here are just a few questions to consider. Out of the 24 hours in a day, how many of those hours are you or your loved ones spending in the lying orientation? How many hours during the weekdays, weekends, holiday breaks, over the summer? Are postural supports used while lying? Are you already using pillows, stuffed animals, blankets to help support the body? When placed in lying, observe body shape. What do you see? Does the head tend to always go towards one side? What do the legs do? As stated previously, 24-hour postural care is one of the most important health interventions for those with severe and complex physical disabilities. This intervention can be utilized with anyone, regardless of age or diagnosis, who has difficulties moving themselves independently and freely. This could include those across the lifespan with diagnoses such as cerebral palsy, muscular dystrophy, spina bifida, spinal cord injury, acquired brain injury, ALS, MS, the elderly population, those with orthopedic impairments, and or genetic disorders, just to name a few. 24-hour postural care should be started before body shape distortions occur. If the individual has a motor impairment that is likely to lead to postural asymmetry, then 24-hour postural management should be started right away. Also, if a child falls within the gross motor function classification system, the GMFCS, levels 4 and 5, then 24-hour postural care and lying should start as soon as appropriate after birth. In addition, the posture and postural ability scale can be utilized to identify an individual who may be in need of 24-hour postural care, including nighttime positioning. Here are a couple of research articles I found when completing my literature review for my research study. The first article noted included the opinions of families in regards to the use of a formal commercial sleeping system, the Symmetrical. 4 out of the 8 families reported that their children experienced less pain when they utilized the nighttime positioning system. The second article was on a different sleeping system that found that parents reported ease in washing, toileting or seating, and decreased burden of care from using the system. In regards to this intervention, there are 2 major biomechanical principles. Tissue biomechanics, for example, in an asymmetrical position, one side typically shortens while others lengthen, and effects of gravity, which in regards to the lying orientation in this intervention is the human sandwich effect. So while lying, gravity is pressing down on the body, and ground reaction forces are pushing up on the body, with these 2 forces sandwiching the body in between. First of all, we have the presence of a motor impairment inhibiting one from moving themselves independently and/or freely. Due to the presence of this motor impairment and biomechanical principles, asymmetrical habitual postures develop. These habitual postures result in tissue adaptations over time, and this is when distortions occur and we see problems arise. These visuals depict habitual postures. So assumed while lying, tissues are changing over time, problems arise, and secondary complications occur. While lying, we can assume different positions: supine, sideline, and prone. We will discuss these three in instances where they should be used. Research shows that lying supine is the best position to control posture and for those with scoliosis. However, if the individual is not used to sleeping on their back or has spasticity, then a well-supported side-lying position may work best for that individual. Prone may be good for resting position throughout the day. Counteracting positions is important in order to stretch the structures that were shortened while in one position for a period of time. For example, if the individual is lying with flexed hips and knees at night, then they need to spend time during the day standing or stretching those structures that were shortened during the nighttime period. We will now go over some of the nighttime positioning equipment available. As you can see, we will discuss both high and low tech options. Here is a list of nighttime positioning supports that may already be within the home or that can be purchased online or in a store. These items are typically easy to obtain and are less costly than high-tech options. Tamara Kittleson-Aldred put together a detailed equipment list with information on where to purchase each piece on her website. I've included this website here on this slide and a list of some of the items on her list. First step is putting down a crosswise layer of non-slip mesh. It should go from the shoulders down to the pelvis or where postural supports will be placed. Here are a few examples of materials that can be used as non-slip mesh. You would then place the postural supports on the first layer of non-slip mesh. You can wrap the postural supports with non-slip mesh, co-band, or vet wrap, and then put it on the first layer of non-slip mesh, or you can place the support on the first layer of mesh and then put another piece of mesh on top of that, like a sandwich effect. Here, postural supports are continued. You can see that we have different wedges, bolsters, and a stuffed animal. A mattress topper goes over the non-slip mesh and the postural supports shown in the previous slides. The final step is to place a fitted sheet over everything. I will discuss a Facebook group later on this presentation that includes a video on how to assemble these materials in bed. Here is an example of a low-tech nighttime positioning system. You can see the layer of non-skin mesh, overlay, trunk, and hip supports, which are placed between the two layers, and additional postural supports such as a leg separator and gel heel pads. Again, here is a visual of a low-tech nighttime system in supine. You can see pillows, bolsters, and a T-roll. Again, here is a visual of a low-tech nighttime system in side lying. You can see several size pillows and bolsters. This Facebook group was created by Patricia Toole, who is an OT and assistive technology professional, and her son Alex, titled Introduction to 24-Hour Postural Care. You can join this group for access to 7 practical lessons that will get you started with 24-hour postural care intervention. These 7 lessons include an introduction, learning to sleep in a new way, respectfully observe, add support, encouragement, use everyday materials, make the bed a new way, try it out, and strategies and timeline. This shows how to use the low-tech postural supports we previously talked about. This is the homepage of the website I mentioned that has a list of low-tech equipment titled Useful Materials for Bed Positioning. This website was created by Tamara Kittleson-Aldred, who is an occupational therapist, assistive technology professional, and seating and mobility specialist, titled Posture 24/7. The website address is listed on this slide. This website includes information on 24-hour postural care, a list of the educational events such as webinars on this topic, and a resources tab that has so many great links. There are also several formal commercial manufacturer-made sleep systems available. Each system is unique and includes different pieces of equipment needed for nighttime positioning based on the individualized needs of the individual. We have the Symmetrical Sleep, Simple Stuff Works, Jinx Dreama, Lecky Sleep Form, and the Certified Adaptive Dynamic Recumbent Sleep Orthosis. I will now provide the website information for each system listed so that you may be able to visit each one. I've included a link for system videos from the Symmetrical Sleep website. If you are interested in learning more about the system, please check out these links. I've attached the link for a YouTube video titled Introducing Simple Stuff Works. If you are interested in seeing the system, please check this out. Here is an example of a formal commercial manufacturer-made sleep system. This is the Jinx Dreama system, and as you can see, this system has a special mattress that is required along with different positioning pads, blocks, hoops, and support straps. I've included a link to their website as well. And here is a link for the Certified Adaptive Dynamic Recumbent Sleep Orthosis. Here is a website that shows how to use a few of the more high-tech, formal commercial sleeping systems. This website was created by Jennifer Hudson, an occupational therapist and assistive technology professional, in collaboration with St. Catherine University OT Masters Project students. It is titled Nighttime Postural Care Training Website. This website includes a series of 6 lessons via video, including one on the introduction to nighttime postural care, risk factors, U.S. sleep systems, setup of the systems, positioning the person in the sleep system, and assessments and outcomes. The videos on this website include the Jinx Dreama, the Symmetrical Sleep, and Simple Stuff Works equipment, which are formal commercial sleep positioning systems. Once at this website, please check in before starting each lesson. It is very important to be knowledgeable about this intervention and know how to utilize it safely. A risk assessment should always be completed before the use of this intervention. This risk assessment includes examining thermal regulation or overheating, as it is one of the most common risk factors with this intervention, respiratory distress, reflux, medications, seizure activity, pressure risk, potential of entanglement in bed covers or supports, the correct use of equipment, compliance in using the program, and the lifestyle and views of the clients and caregivers. Patients in need of this intervention may have troubles regulating their temperature, therefore it is important to assess this before adding supports into the sleeping area. In cases of reflux or respiratory distress, the bed may need to be tilted to approximately 15 degrees in order to minimize the reflux, but still keep the individual from slipping or sliding out of bed. If the individual experiences seizures, a well-supported sideline position may need to be utilized for safety from aspirating or choking. Make sure bed covers and postural supports are anchored down to prevent entanglement, which can result in suffocation. To prevent pressure injuries from occurring, make sure that postural supports or equipment are being utilized correctly and that the individual isn't spending too much time in any one position. For the health and safety of the client, it is imperative that these things are assessed, addressed, and that there is a plan in place. There is also more detailed information in regards to risk assessment in Seating and Wheeled Mobility, a clinical resource guide, in the Posture Management 24/7 chapter, and there's a video on risk assessment on Jennifer Hudson and St. Catherine University OT Students Nighttime Postural Care Training website, which was in the previous slide. The purpose of this intervention is to raise awareness about this intervention and to empower others. If interested, you can utilize search engines to learn more about therapeutic nighttime positioning as part of 24-hour postural care. You can talk with your health professionals, such as OTs, PTs, assistive technology professionals, or seating mobility specialists. Also, you can review the websites and Facebook pages I shared throughout this presentation. With this intervention, one should start low tech and slow, maybe adding a small support here and there. You may also have to try different things as everyone is unique. Here is my Carter lying unsupported and then using things we had around the home to provide support while lying on the couch. Here he is again supported in his beanbag chair as his legs tended to sweep over to the right, so we propped them up with a soft pillow or stuffed animal. And here is Carter's little brother, Bastion. On the left, you see him unsupported, and on the right, he's utilizing postural supports to be in a more aligned position. I just want to thank you all for your time. If you have any questions or would like additional information and or resources on this topic, please reach out to me anytime. I've included my email address on this slide. It's just my first and last name, all lowercase, @gmail.com. And here are my references. Please contact me if you would like any further information on any of these. Thank you.